The first time I met Steve was intern orientation, although I knew about him because I had a few friends in the year ahead of me, and they would talk about their residency director, Steve. And I'm like, Steve? Like, isn't it Dr. Shelov? No, it's Steve. And you'll understand why when you meet him. He was warm, he was welcoming, he was approachable. He was really my role model from the get-go in many different ways.
The best way to describe him, he is the quintessential pediatrician. Because this is something that pervades not just his relationships with his patients and with his families, but who he is temperamentally. He is a very, very caring and compassionate human being. He is someone who listens extraordinarily carefully and who organizes people to get something done in a way that makes everyone really want to participate in whatever that endeavor is.
And he was, again, always available, not only for the faculty, but for our children. For example, my son, Steve became his mentor. So it's really exciting as a parent to see that, to pass this along generation to generation.
He was caring and nurturing, and he interacted with parents the same way he interacted with nurses.
Steve is a welcoming guy. He's pleasant when you see him. He's so affable. Never says no and never takes no for an answer. He's very, very persistent.
Steve made us feel like a family, but he also demanded rigor and the best care of the patients.
The reality of the Children's Hospital at Montefiore would not be without Steve's involvement.
He was essentially one of the founding visionaries that thought that this was not only possible, but was necessary.
His advocacy, his meeting with philanthropic donors, and his planning all were essential to the creation of the Children's Hospital.
And this medical institution, this Montefiore, was the backstop for all of that. It provided neighborhood health centers, it provided neighborhood clinics, it provided expertise for the best care for their children, intimate, crucial for the need that was here in the Bronx. No other part of New York City, I think, is as is the Bronx. I remember designing what the new infants unit would look like and the adolescent unit would look like, and why this is such an important space. And to see it actually in brick and mortar, it's well cared for, people are pridefully involved.
And I think that his guidance with regard to the entire development of the institution was very, very important. And so the institution, even to this day, reflects a lot of his thinking with regard to how pediatrics as an inpatient service should be delivered to a population of folks like the one that we have here in the Bronx.
I think having a children's hospital here in the Bronx, which could provide the highest level of specialty care with excellent primary care, with support from child life, social work, the multidisciplinary nature of our field under one roof to provide the best care for our patients here in the Bronx and neighboring areas, eventually having a national, international reputation. That was his dream.
Been a wonderful, lucky journey. One always has to consider yourself fortunate to have had these opportunities and to take advantage of them and make sure that they live beyond you. But this is in a special place in my mind.